Take it, Sandy.
It's better when I'm perky.
Okay.
It is, and this is Stephen Dunn. We're just, look at Stephen. Oh, he's just like, winking at Dan.
You're
These boys
in
are up
her
to
sights
something.
now.
Yeah, no.
That's okay. He's going to talk to us about personal care, home health care. Specifically, what is personal care?
Well, well, for the past,
it is in general, but be more specific for me.
Okay, more specific.
Yeah.
The home health for the past 30 years, we've gone out into the home and done skilled nursing needs, physical occupational therapy, speech therapy, things like that, where we could go out to the home and do tasks that take 20 or 30 minutes, wound care, colostomy care, physical therapy for just a short amount of time for a skilled need. And what the hospital did, they noticed a unmet need for our patients. And so for this reason, we started the personal care program. And what this allows us to do is to send certified nurses aides out into the home for hours at a time, at a minimum of 2 hours, and they can stay there all day if they want, and just help with whatever the patient needs around the house, basically. Washing dishes, watering plants, doing laundry. They can go do errands for them, go and get some groceries if they need it.
But that doesn't mean that the person going out there has to be registered nurse or
well,
LPN or...
You said a licensed...
certified nurse's aide is what they are.
A certified nurse's aide.
Yeah.
So they have had to, it's like a week or 40 or 80 hours
I think it's like a
training
semester of training in college.
They take quite a bit of training so that you could...
And this allows them to go out and know the proper way to take a patient out of bed and help them to the bathroom or give them baths and stuff like that. And
that's important.
Yeah.
Because it's not, there's a lot more to it than, well, yeah, just grab them, lift them up.
Yeah. And you know how fragile, other elderly people can be. And
so that need was not met with the regular home health?
No.
No, because those were more like RNs and stuff.
Exactly.
Go out and do the serious wound care, but it's not like,
they're
not going to wash a few dishes before they leave.
Exactly.
That's, okay.
And in the home health, we did have the aides that could go out and maybe do a bath for the patient, but it was limited to that, really. And that's why we started this. And really what personal care does, more so, if you've ever had a relative or a good friend that was down or elderly, debilitated, it gives you the comfort to know that they're being taken care of while you're at work, or if they live in a different household, you know that your mother or father is being taken care of and being watched over, getting the things they need done. And it allows the patients to live a independent, successful life at home, rather than having to move into a nursing home or be habitually put back into the hospital, in and out of the hospital continuously.
No,
go ahead.
No, I was just going to say, as I butt in all the time, Dan. It takes a burden off. You're talking about the caregiver, because I have a couple of friends who have elderly mothers, and one of them, you hate to go, boy, you look tired, but she said it's like where I'm working. She works a full-time job. She takes care of her family at home, and she goes to her mother's every day, does the lawn, because her mother doesn't want to move in with them, but she's not to the point where she needs to be somewhere else, and so literally it's like a second job.
Yeah, you're right.
To just take care of, like getting her mail in and doing her errands and picking her house up and stuff like that.
Yeah,
so it's not just for the person,
like you
it's
said,
for the caregivers.
I mean, she doesn't want to move out of her own home, and I wouldn't either.
And she doesn't want to be a burden.
Exactly.
She doesn't want to be a burden.
Yeah.
Yeah.
Are there limitations to what care that you can give that person? Does it extend to the pets and that kind of thing?
Well,
too,
I mean, of course we can help feed the pets. Just really just household duties. They call them as activities of daily living. Whatever it takes for this person to live a successful life at home. We're an aid to the patient to go in there and help them live that life at home without having to move out because they're unable to anymore.
Are you looking for extra CNAs to help out with that? Or?
Well, we've actually staffed up. We hired 5 or 6 aides before we even started this, had them go through all the training, had them work through our home health agency, doing the tasks that the home health aides do to get them trained and ready for this. And we actually started it about a month ago. And I mean, it's something
we're very
excited.
So it really is brand spanking
new
program.
Is, yeah. I mean, it's been a long time coming too. We've been working on it since January, and we have a lot of patients that are really excited about it. I mean, it really, really helps out a lot of patients.
Can people use that even if they don't need the other care? Like
Oh, yeah.
So just the daily living, personal care part, even if they don't need the other home health?
Absolutely.
Okay.
It's something that we either do separate or we do together. Some patients have home health and they also use our personal care service. Some people just have home health, some people just have personal care service. So just whatever the needs of the patient are and the family. I mean, that's what we like to do.
And for people who want more information, what can they do?
Give us a call at the personal care department. It's 508-1778. For our home health office, it's 1790, 508-1790. And we'd be glad to talk to anybody about it.
Okay.
It's covered under Medicaid, I'm sorry, Elder's Choices, insurances, workers' comp, and of course private pay. So.
Okay.
And this actually takes the pressure off the family where it can allow the elderly to live at home independently.
Exactly.
Yeah.
That's exactly what we do.
And it covers not only RN care, but also personal care too.
That's what home health does, yeah.
Right. Yep. Well, Stephen, thanks so much for coming by. That's great information.
Thank you.
And I hope that our viewers out there
a
can
brand
benefit
new
from
program for Baxter County Region.
Yeah.
Well, I tell you what, you guys are into all kinds of stuff.
Yep. Going
Thanks,
places.
sir.
Going places, yes.
Thank
you.
All right, up
Who's
next,
next?
Mary Jo
and
McLean.
Barry? Okay, good.
There we go. Stay with us.
Duck races.